Hi, my name is Veda Fountain and I am a USA nursing student, and today I'm going to be cleaning the CVAD. So when I walk in, I will go ahead and perform hand hygiene. Once I'm done with that, I'm going to go ahead and get my supplies. So I have my supplies right here and I have my patient right here. So I'm going to go ahead and do is go ahead and open this part up. And then in here there's a mask, and I would normally place this on my patient before I remove the old tegaderm dressing. Okay, so I'm going to go ahead and open up my supplies, making sure that I don't cross the border. Okay, once I'm done with that, I'm going to move over here and put on my sterile gloves. Okay, and because this is sterile on sterile, I can now fix my gloves. Okay, and once the gloves are fixed, now I'm going to move over here and I'm going to go ahead and rearrange my site. I'm going to make sure that I stay well within the 1-inch border here. Okay, and then after this, I'm going to go over here to the patient. I'm going to look at, okay, it's still not touching my sterile field or anything like that. So I'm going to look at my patient. I'm going to make note of their site. I'm going to make note if I see any kind of drainage. If I did, I would maybe get a culture for it. I'm going to make note of the site, see if I see any tenderness, or not tenderness, but any kind of redness or swelling or anything like that, and I don't. So I'm going to move on to cleaning it. So I'm going to go ahead and grab first is the alcohol swab. So with this, I'm going to go ahead and clean around it. I'm going to go in circles, making sure I don't overlap. Making sure to keep my sterile hands off of the patient and off of the bedding and the wound. Not the wound, but the cleaning area. Okay, once that's done, then I'm going to go ahead and wait for the alcohol to dry. And then I'm going to go ahead and grab the chlorhexidine prep. I'm going to go ahead and snap it. And then for this one, I'm going to use this hand to hold the wire up, and I'm going to clean with this hand. So now that I have touched this one, this hand is no longer sterile, but this one still is. So now I'm going to go ahead and clean vigorously for 30 seconds. You can go vertical, horizontal, and circular motions, making sure not to touch my sterile hand to the non-sterile stuff. And I'm going to go ahead and clean the wires as well, underneath and up top. Like I said, do this vigorously for 30 seconds. Okay, and once that's done, then I'm going to go ahead and trash that. And then after that, I'm going to go ahead and grab the bio patch. Right here. Okay, and I'm going to go ahead and place the bio patch. The printed side up and the little foam side down. Okay, now that that's placed, now I'm going to go ahead and grab my tegaderm. So I grab it with both gloves now. I'm going to go ahead and unwrap this. Okay, and I'm going to go ahead and make sure that I only touch the edges of it, and I'm going to go ahead and place it on top, making sure that the tegaderm is about center of the CVAD area, and make sure that it is nice and enclosed. And after this, I'm going to go ahead and get my label and place it on top. And on the label, it states the day, the time, and my initials. So once I'm done with this, I'm going to go ahead and raise the side rails, lower the bed, make sure that the patient's comfy, and then I can move on to my documentation points. So now that these are nice and non-sterile, I can go ahead and take them off. Okay, now moving on to my documentation points, I'm going to make note of how well the patient tolerated the procedure. I'm also going to make note of the type of cleaning agent I used, as well as the dressing that I use. I'm going to make note of the time, the date, and if there's any kind of drainage, if I got a culture swab or anything like that. And as for the drainage, I'm going to make note of the color, consistency, type, amount, and if there's any kind of odor. And like I said, I would make note of how well the patient tolerated it. and if I noted any other odd things about the site, whether it be swelling, redness, or any kind of tenderness as well.